Hello, everyone. Thank you all for joining us today, and welcome to this webinar titled Public Health and School Health Education, Aligning Forces for Change. My name is Jordan Buckley, Manager of School Health Programs at SOPHE, the Society for Public Health Education. On behalf of SOPHE, we are excited with the interest in today's webinar and are thankful that you have taken the time out of your day to participate. Before I hand it over to our speakers today, I'd like to cover some housekeeping items. First, please note that all attendees are muted for the duration of today's webinar. To interact with the speakers, please use the chat box. After hearing from our presenters, we will have a question and answer session with the time remaining. Questions can be submitted at any time during the webinar by typing in the chat box. We value your feedback and ask you to complete the feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program will assist us in planning future webinars. Please know that today's webinar is being recorded and will be made available on demand on SOPHE's School Health playlist within 2 weeks. As a quick introduction, if you want to learn more about SOPHE, SOPHE is a nonprofit organization founded in 1950, dedicated to providing global leadership to the profession of health education and health promotion, and to promote the health of all people. Members include health education professionals and students throughout the United States and international. The organization promotes health behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. Now, I am excited to introduce today's speakers, Dr. David Birch and Dr. Donna Videto. Donna Videto has worked in school health education and pedagogy for over 40 years. She is an ASHA Fellow and a CDC HECAT trainer. Donna has a number of national publications, including Birch and Videto's 2015 Promoting Health and Academic Success, the Whole School, Whole Community, Whole Child Approach, with over 150 national, regional, and state level presentations at conferences and committee work for SOPHE, ASHA, and ASHA. Currently, Donna serves as the Vice President of FAHE and is a member of SOPHE's National Committee on the Future of School Health Education. Dave Birch is a professor in the Department of Health Science, University of Alabama. He was also a faculty member at Indiana University and Penn State University. Dr. Birch is a past president of the American Association for Health Education, or ASHA, and SOPHE. Currently, he serves as a member of the Board of Directors of the Foundation for the Advancement for Health Education. He has received numerous prestigious awards, such as some of the highest awards from 3 organizations, such as ASHA's 2019 William A. Howe Award, the SOPHE 2018 Distinguished Fellow Award, and the Eta Sigma Gamma Honor Award in 2015. His research interests include professional preparation, professional leadership, education, health, reciprocal relationship, and the whole school, whole community, whole child model. Dave and Donna, I am so excited to hand it over to you.
Well, thank you, Jordan. Well, good afternoon, everyone, and welcome to our webinar. We look forward to sharing the work of the SOPHE ASHA, Society for Public Health Education, American School Health Education, National Committee for the Future of School Health Education. We're not only going to be sharing the work, but we will also be gaining your input into the work and your thoughts on the work. And so we look forward to interacting with you during the webinar. Just a little bit of background on the National Committee. And again, it's the National Committee on the Future of School Health Education. You can see the charge there. And what we will be focusing on today are the second and third bullets in the charge. And so you can see what those are, and that will be the focus of our presentation. The National Committee was formed in 2016. It emanated from SOPHE's strong commitment to school health education. The committee works in collaboration with the American School Health Education, and I'm one of the co-chairs of the committee. I've been the co-chair since its formation in 2016, and the co-chair with me is Sharon Murray, who represents the American School Health Association. And when the committee was formed in 2016, I was the president of SOPHE, and Sharon was the president of the American School Health Association. We have established leaders on the committee, emerging leaders, representation from the Society of State Directors, school administrators, teachers. It's a very diverse professional group, and our calls, certainly we have a lot of interesting input from our members. Now, we looked at the charge, and so we are going to focus today on the products, a product of the work of the National Committee. And this product was actually published in 4 articles. And those articles were in the November 2019 issue of the Health Promotion Practice, the SOPHE Journal. And we want to thank the CDC School Health Branch for supporting the printing and the open access dissemination of those articles. So just taking a quick look at the articles, the first article is an introduction to the series of 3. And again, today, we're going to take time and focus on each of the 3 articles, which are second, third, and fourth on your listing there. And again, these were published in SOPHE's Journal Health Promotion Practice in November of 2019. Donna is going to present the first 2 of the 3 articles, and then I will present the third article. So what I'd like to do first, before we move forward, is pose a question to all of you about the National Health Education Standards. So Jordan, if you want to pose that question.
So everyone can now see a question on your screen. What is the level of familiarity with the National Standards for Health Education? And Dave, these results are now on the screen under surveys.
Okay. And let me, okay. All right, so so we have about a little bit over half who are familiar, either very familiar or familiar with the national standards, and then the other half who's aware but not familiar or not aware at all. So that's good. Again, with this, we have a group of probably coming in with different levels of background and awareness of school health education. So that will be helpful. Let's look at the standards. Okay, and so let me go back and all right, Jordan, I'm going to need a little help here to get back to the slides.
All right, we're back to the slide. Perfect.
Okay, and I still have this. I still have the results on my screen. So I just.
Okay, the results are over. You can go back to the slide.
Okay, and question is, how do I go back to the slides?
Hit slide.
Okay, got it. That would do it. Okay. All right. So now the standards, this version of the standards is the last version, 2007. So we're getting close to the time to revise the national standards. And you can see these present the intended outcomes for students in quality comprehensive school health education. And obviously, these standards should not only drive instruction in health education, but also drive assessment of students' learning. So those are the 8 national health education standards. Okay, so Jordan, let's go to the next poll. And CDC has also developed characteristics of a quality school health education program. And so we have a question for you in regard to those characteristics.
So there is now a poll on your screen. What is your level of familiarity with the characteristics of an effective health education curriculum?
Okay. So a little less familiarity with the characteristics. About 45. About 45% of people are either familiar or somewhat familiar. Let's take a look at those characteristics and talk a little bit about those. So if we can go back to the slides, Jordan. Okay. So you can see the characteristics are really present what should be happening in a classroom. What should the curriculum and instruction look like? And obviously, you can see that they are linked to the national standards, right? And we have 2 slides for the characteristics. And there you see the second set. Okay. And then also, while we're focusing today on school health education, I just wanted to take a quick look at the whole school, whole community, whole child, known as the WISC model. This is an education and health model to promote both learning and health, and kids who do well, and to promote kids doing well in school, and kids who are promoting their health and the health of their families and the community. And just a few notes about the model. The model features the school as a part of, or as a member of the community. And the child, you can see the kind of figure of a child there. Child is at the center of the model. And then there are 5 basic tenets that you can see in the model. And then 10 components of varying school programs. And you can see that health education, which we'll be focusing on today, is one of those 10 models. So a very key part of quality school health education is being a part of a larger whole school. At the 3 articles that were in health promotion practice. These 3 articles came out of the National Committee, and the articles identify specific challenges related to school health education, and then also recommendations to address those challenges. So we're ready to move to the first article. So Donna, if you want to pick up from here.
Sure. Thank you. Hello, everyone. This is Donna Videto, and I'll be talking about the first two articles. The first article, Promoting Health Literacy Through Defining and Measuring Quality School Health Education. For a little background, we have all seen that educational shifts toward Common Core and other instructional mandates have often occurred at the expense of school health education. Well, this particular article proposes 3 challenges that can help refocus our country's efforts towards positive impacts that quality school health education can have on our youth. The first challenge that occurs within this article is making quality school health education the new norm. Well, quality school health education can achieve health literacy and help young people to adopt health-enhancing behaviors through the development of core concepts and skills as presented in the National Health Education Standards, as well as by following the best practices as presented in the characteristics of effective health ed curriculum, both of which David just introduced to you or discussed earlier in the slideshow. Having a universally accepted expectation or norm regarding what should be occurring in school health education is critical and must involve input, support, and advocacy from teachers, the community, all the way to the state and professional and government agencies and organizations. Our second challenge in this first article is making the case that school health education really is key to health literacy. So we're looking at the link between health literacy and school health education, and it must be stressed with an emphasis on the role of the National Health Education Standards in achieving that health literacy. While defining health literacy in regards to achieving these broader health outcomes in terms of healthy behaviors versus a very narrow understanding that looks at only clinical behaviors, which has historically been the case. We are recommending that pre-K through 12th grade health education needs to be supported as an avenue and a means to achieve health literacy. Our third challenge in this first article is about defining quality school health education and establishing relevant measures to determine success of that health education. So in order to convince others of the importance of quality school health education, we need to be able to identify, establish, and communicate measures that show its success, what it can really achieve, from changes in attitudes, skills, and behaviors to impacting health trends and creating healthy communities, while at the same time communicating those measures, providing training and tools, as well as gaining state-level support to put a priority onto these outcomes that a quality school health program can achieve. Those are the three. Well, this article is about creating change in the culture and perceptions related to school health education by stressing the importance and value of a quality program. What we'd like to do now is ask for your opinion on the three challenges and to which one that you would like to see a stronger focus on. So, Jordan?
All right, so the results are starting to come in. So please, again, select the challenge from Article 1 that you think is of highest priority for the profession of health education.
Well, that seems pretty strong. Oh, here we go. So it looks like our second Our third challenge is gaining more.
And I'll close it in just a couple seconds, so please take your one last chance to review them. I know that there's a couple to decide on.
And Donna, if I could just mention that we're going to be sharing these results with the National Committee. So this is very important input into the work of the committee.
Yes, thank you, David, for that. And it does look like our second challenge has a tiny bit of a stronger lead over the other two. But it seems that they're very close and that people perceive all three as being very critical. Excellent. Well, thank you for that. Jordan, are we done?
Yeah.
Okay. Thank you. And thank you for your input. So what we just did, we're going to continue to do the same thing throughout the three articles that we're addressing. We're going to ask you to pick which of the challenges that we posed from those articles, again, that you feel you'd like to see a stronger focus on. And again, we'll be sharing that with the National Committee. So this takes us now to the second article in the series. And this article offers 4 challenges to the implementation of effective school health education. And it does that by the promotion of social and system level conditions to support, elevate, and assure the delivery of quality school health education. The first challenge in Article 2, or the 4th challenge in this series, is presented here. Due to the state and federal priorities that I mentioned earlier, health education has been reduced or eliminated to make way for reading, math, writing, and science. And often where school health education exists, it is reduced to a limited number of health issues versus a comprehensive approach. The importance of addressing health issues such as healthcare costs, increasing interest in access to valid health information, and being able to deal with health issues such as we are dealing with today shows confirmation of the importance of implementing quality school health education. And now is the time for stronger advocacy at the federal, state, and local levels for it to occur. It is critical that we engage one or more highly influential health-related organizations in funding and spearheading an advocacy and communication campaign to promote the delivery of quality school health education. The second challenge in Article 2 looks at the challenge of reforming educational institutions to strengthen their capacity to deliver quality school health education. By aligning instructional and organizational missions, structures, and systems, can the highest goal of schools and school health education be achieved? We need to create an environment in which successful implementation of quality school health programs can occur, using strategies such as delivering health education in the context of the WISC model and aligning health education with the National Health Education Standards. A critical need remains for establishing a more collaborative mechanism to coordinate the efforts of groups interested in supporting large-scale delivery of high-quality school health education. This is at the core of the third challenge in Article 2. National organizations and agencies can convene meetings and dialogue on how to create these avenues for providing thought leadership to the field, especially as related to overcoming implementation challenges, with one example that was provided in the article, which David made mention to, is the updating of the National Health Education Standards. Research indicates that a number of barriers stand in the way of effective health education implementation. Barriers such as lack of administrative support and at times inadequate teacher preparation. It is important that we identify and adopt effective strategies to address the system-level barriers, which brings us to the fourth challenge for Article 2, or the seventh in the series. Building multidisciplinary research capacities and conducting the types of research necessary for us to determine what really is effective is critical. A research agenda for schools and school health education can be developed with the goal of directing future research toward agreed-upon professional priorities meant to move the health education field forward. So in order to ensure a basic level of health and health literacy, we need to provide high-quality, comprehensive health education through our public school system. To achieve this, it will require addressing the social and system-level challenges that stand in the way. Therefore, 4 challenges and recommendations were presented in this article. So let's take a look at the poll for the selection of the challenge that you think we should put a stronger focus on for Article 2. Jordan?
Excellent. Please select your answer in the live poll that is now on your screen.
I'm still seeing Article 1 survey.
Yes, me too. Likewise.
Here we go.
The results for the Article 2 are appearing for the audience. If you have just one more second to submit your result, if you haven't, Donna, are you able to see the results?
I am. I'm seeing them now.
Oh, great.
It appears that the reforming educational institutions to strengthen capacity for reliably delivering large-scale, high-quality school health education is running a little bit ahead of the others. Very close to the first challenge and the third challenge in that series.
Jordan, I'm still just seeing Article 1.
Click on Q4.
I'm sorry. Pardon me, Donna?
On the side under Managed Surveys, click Q4.
Got it.
Okay, well, I think, again, we have 3 that are fairly close, but again, the second one seems to have gained a little more support than the others. Thank you again for your input. And having said that and done that, I am now going to hand it back over to David to talk about Article 3. Thank you.
Okay, thank you, Donna. The third article, as you can see from the title, addresses quality assurance. And I think those of you who have been around school health education for any period of time, or perhaps even those of you who are thinking back to your health education experience as a student in middle school and high school, may be able to connect with the idea that often people who are assigned to teach health education are not necessarily prepared to teach health education. And so in putting Article 3 together and identifying the challenges and making recommendations, we really wanted to make sure that we addressed in a thorough way the issues related to professional preparation or teacher education in health education. And I think certainly there's research that supports this, but I think all of us recognize that even in the strongest infrastructure with the best curriculum, if we do not have a teacher who is passionate and prepared, health education is not going to be what we would like to see it be. So let's just take a look at the challenges that we identified in this article. And you can see this is, we have actually 5 challenges in Article 3. And this is the 8th in our series of 12 challenges in the 3 articles, and the first in Article 3. And it seems logical, but the importance of people who are teaching health education having adequate professional preparation and being certified in health education. And you can see that the recommendations that we have made in that article are certainly specific to this. And we have several recommendations for this. So let's go to 9 now. So another issue in health education, professional preparation, is at the elementary level. Now, as a university teacher, I have the opportunity to talk to college students about their perception of their middle school, high school, school health education. And I can tell you we still, even after I've done this for 30 plus years, asking students to grade their health education when they were in middle school and high school. And I can tell you that the grades are not very good and that they really have not improved that much over time, over those 30 plus years. But when I ask about elementary level, when we discuss this, most of the students say they don't even remember any health education at the elementary level, or perhaps what they remember is just a focus on one topic. And so one of the things that we know, we think it's logical that elementary classroom teachers teach health education. They're prepared to work with elementary age kids. But we do know that quite often elementary teachers have not had any professional preparation in health education at all. And so basically the recommendation that we have with the elementary challenge is that the in elementary professional preparation or teacher education, the students are required to take a course that presents them with a background in health, and then a course that prepares them to teach health education. So that was the second challenge that we recognized. The third challenge is also certainly has a history in our profession, and that is the idea of dual certification for health education and physical education, dual majors. And certainly we are not opposed to people being certified in health education and physical education if they are adequately prepared in both topic areas. And I've been involved in discussions about this for a number of years, and Donna and I have talked about this for a number of years, and we don't see how it would be possible to adequately prepare someone to teach both health education and physical education within a four-year undergraduate degree program. And and there are many states that have dual degrees in health education and physical education, and even in 2019, 2020, many of those dual degree programs are very similar to the program that I went through many years ago, which was a dual major in health and physical education. I was certified in both areas. I was very well prepared to teach physical education out of my undergraduate degree, but not prepared to teach health education. And we still have many of those dual degree programs in which there's more emphasis on physical education and health education. And I think we all recognize the distinction. There are different standards. There are two disciplines. There are different standards for health education and physical education, different content, different instructional methods, different assessment, and they take place in different venues. So, but there's still, in the general public, a lot of folks who, when you talk about the fact that you're a health educator, they immediately think that you are a physical education teacher. And I've also seen people in very important decision-making positions, including legislative aides on Capitol Hill, who, when we talk about health education, they immediately think we're talking about physical education. So, so there needs to be a clarification of that distinction, and you can see that the second recommendation related to this is to recruit other organizations to partner in promoting this distinction. Okay, and there you see. Okay, so the fourth of our 5 challenges with professional preparation is to provide support for teachers to receive ongoing professional development. And obviously that's important because we know that health and thus health education changes over time. We know that what we know about teaching and learning changes over time, and that health education and health educators need to be tuned into this. And we also know that that professional development is needed for many teachers who may be secure in their teaching position and may be in line to teach health education for a number of years, but they really need to be retooled as far as their background and skills related to instruction. So you can see there that the 2 recommendations that we have on this slide are to require a minimum number of professional development hours for continued state certification, and then offering the in-service credits through health education professional organizations, and then working with national organizations to develop professional development for health education teachers. Okay, now going to the very last challenge and the related recommendations is related to research. And we feel there's a real need for research in health education. It's my personal opinion that as far as our research agenda and our research productivity related to our professional preparation of school health educators, that we are behind what is done in research in other disciplines. So if you would look at professional preparation and teacher education in math, or you would look at it in science education, you would probably see a larger body of literature and more rigorous research that's done. So there's a lot that we need to look at related to teacher education and professional preparation in school health education. And so we're presenting several recommendations there to address this challenge. Okay, so you had 5 challenges there. And so, Jordan, let's put this poll up and see what seems to be a priority. And again, I want to stress that this will be important to us as we work with the National Committee to inform us of what others see as important in the challenges that we've presented.
So we'll take about 10 seconds. So you'll see this poll on your screen again. So select the item that you think is of highest priority from Article 3. And the results are now live.
Okay, so there's certainly strong support for the research recommendation, 37% of the folks, and also strong, not as strong, but a strong level of support for making sure that teachers have adequate pre-service preparation, and then also for professional development. A little support for the dual certification for health education and physical education, and just a little higher, but a lesser support for the elementary issue. So again, your responses to these polls will be very important in informing the National Committee. We're in the process right now of making a final determination of the challenges that we will focus on, and we're not going to focus on all of them right out of the gate here this year. But we're going to identify 4 or 5, and then we'll be assigning members of the National Committee and then reaching out to others in the profession to work with the committee in addressing these challenges. So what we'd like to do now is to have a chance to interact with you and respond to any questions that you have or any thoughts that you have related to the articles or anything in the presentation. So, Jordan, we're all set for Q&A.
Sounds great. So just a reminder to everyone, so we do have a chat box where we have a Q&A function to answer and complete questions. And we also have an audience chat that is going on. So if you've submitted anything in the audience chat, or if you've been connecting with fellow audience members, that is fabulous. But if you're able to copy any of your questions over to the Q&A, that'll help us to moderate questions in the order received. And we'll go through questions in that way just to help us with the many questions that we've received so far. So that's great as well. Dave and Donna, I'll get you started here. You'll see the first question listed in the Q&A, which looks like it relates to the most recent article that we have covered. It touches on challenge number 10. So if you look in the Q&A box, there is some text that explains the background of the work that this person is doing and then addressing challenge number 10. If you would like me to read that.
Yes, and I'm the Q&A box.
Yes. So I'll start
Okay.
reading that if you would like to see that as well, and I'll pop over and turn this slide on. So the issues are real. Those who are passionate about are present today. Some of this is buy-in at the state level that trickles down to the local school districts. This is especially challenging in states that only will certify teachers as a combined HPE degrees with the emphasis on PE. In addition, we have a teacher certification exam that focuses on content rather than being able to teach the skills of the standards, so NHES. Moving to the ED CPA, where there is more documentation for demonstrating their teaching rather than their knowledge. And then they said again that number 10 is addressing this. So do you want to comment on that?
Yes. Well, I'm assuming that the reference is to the Praxis 2 exam, and the questioner participant is right on target with that. We have certainly discussed that with the National Committee, and we hope to address that, as pointed out, with recommendation, the recommendation for working with stronger certification. So yeah, that's definitely an issue, and unfortunately, what that has done in some states is because of the relatively easy path to certification in health education, and my guess is that this happens in other disciplines too, but for teachers to pick up an additional certification, the easy and less rigorous path, what undergraduate students are often doing now is they are majoring in one area, and then rather than we lose health education majors often, and this is anecdotal, so it's I don't have data that show this, but often to physical education programs where students are told that what is best for them to do is to major in physical education, and once they get a job in physical education, they can pick up a second certification in health education. And so what it's done, that has had an impact on even some of the stronger undergraduate teacher education programs in health education, where the numbers of students enrolled in their programs has really dropped. So that is definitely an issue, and it's an issue that we discussed with the National Committee.
And this is Donna. I just wanted to add issue about EdTPA. For those states that do require the student teacher to
Jordan, I've lost
Donna, are you still there?
somehow. This is Dave. I could not hear Donna's response there.
Hopefully we'll get Donna back on.
Okay.
And Donna, if you hear this, we'll just
I
try to reestablish.
I caught just the very beginning of Donna's response, but something she said just reminded me of another issue, and that is that one of the challenges when we do prepare students to go out and teach school health education is that often we have a challenge in finding a student teaching or internship site for them because many of you may have experienced this, that sometimes the students that we have prepared are better prepared in health education than the person who is in the role of supervising or cooperating teacher. I don't think that's where Donna was going with that, but when I heard that at the beginning of her response, it reminded me of that. Okay, other questions, Jordan?
Thanks, Dave.
Mm-hmm.
So the next question that
Sure.
I see here is, are there considerations to include school district or campus-based advisory councils?
Yes, we talked about that, and certainly we think that's important, and we actually see that as it addresses school health education and is important to school health education, but we talked about that as also something that's important to the WISC model and the larger model itself. So we certainly discuss that and place value on the importance of that, but it was something that we did not list as a specific challenge, or did we address it directly in a recommendation?
Great, and I'll move on to the next question.
Mm-hmm.
And again, everyone, this is recorded just in case everyone is trying to take notes or you're interested in learning more or even watching it again. So how does one convince school leaders that health education professional development for teachers should be a priority?
Yeah, well, it's a good question. And I think that's probably another webinar. But just a few thoughts that I have a few thoughts on my own on that is, one, unfortunately, often school administrators are not aware of what are those characteristics of a school health education program, those that we presented earlier today. Or also they may not even be familiar with the clear distinction between health education and physical education. They may not know that there are health education standards. And the other thing too that I think is difficult is if they as students have not experienced quality school health education, and in their career as educators have not observed quality health education, it's difficult for them to place a priority on that. So what that means is there's a real need for school decision makers to be educated or informed about what we mean when we talk about quality school health education and all of the issues that it addresses, and that quality school health education within the context of the WISC model can help students actually in their learning, and so that the idea of healthy kids are more likely to be academically successful than unhealthy kids. And so I think it has to be presented to school administrators as, one, this is what we mean when we talk about quality school health education, and two, this is not just something that contributes to health, but it contributes to academic success.
And I think, and this is Donna, and I think if you look at any of the work around the risk model and around CDC Healthy Youth, you will see a number of articles and research-based presentations in regards to the links between health and academics that can be presented to administration, as well as slide presentations and the like. So getting a school health team or wellness team together and presenting that will help to increase support in that area.
So at this time, I would like to say thank you again to everyone so much for all of your questions. And if you do have more questions at this time, you can, of course, reach out to SOPHE if you want to learn more from our presenters or to be in touch with our presenters as well. And we can be in touch with you about some of those next steps. But we will continue with some more information just to keep this rolling. And we hope to continue to be in contact with you to share some more resources. So at this time, I do want to share that in connection with this school health webinar series, SOPHE would like to share some more resources that you may have heard about. So SOPHE's school health page has access to contemporary resources, tools, information, and training on current and emerging topics for health educators and other leaders for health. So most recently, we have shared WISC team training modules with a set of instructions for states, districts, and schools to build, strengthen, and sustain school health teams implementing the WISC model. And this resource and all the others that you see on this slide, along with this webinar series, are supported by SOPHE School Health Project in collaboration with CDC Healthy Schools. So if you'd like to learn more about that, you can, of course, connect with me. And if you want to learn more about other resources that we might have touched on throughout this presentation today, you can, of course, learn more about CDC Healthy Schools at the link listed here. You can sign up for SOPHE School Health Updates, and you might want to learn more about SOPHE as a spa. So we have a webinar that is actually coming up this Thursday, which is April 23rd, on SOPHE and the Health Education Teacher Preparation Standards, which were recognized by the Council on Accreditation in Educator Preparation, or CAPE, in 2019. SOPHE has been designated as the Specialized Professional Association, or SPA, to review professional preparation programs seeking national recognition for their initial health education teacher credential. So this webinar will present more information on that, and you can, of course, connect with us to learn more. So this webinar will present the 6 new standards and 28 components in the HETP. It will also discuss the next step in SOPHE SPA process, sample rubrics, and exemplars, and the timeline for SOPHE SPA review and recognition for programs, and how health education faculty and pre-K through 12 health education teachers can become involved in the SOPHE SPA process, very similar to some of the work that we have discussed on this webinar today, and how all that really fits in well together within the home of SOPHE. You can also learn more about finding upcoming SOPHE webinars on our calendar on SOPHE.org. And with that mouthful, I will say thank you all so much for joining us today. Thank you, of course, for our speakers and for all of the work that they are doing with SOPHE as volunteers, with our national committee, and even more. And thank you again for joining us. And if you want to connect with us in the future and keep learning about the resources that we keep sending to you. The webinar that you listen to today will be recorded and archived within 2 weeks on SOPHE School Health playlist. If you have any questions, just please email info@sophe.org. Please take a moment to complete the brief feedback form that will pop up in your internet browser following this webinar. So Donna and Dave, thank you again.
Thank you.
Thank you.
Thank you, everyone. This ends our session today.